Kim is here for a diabetes visit. Let's join Linda as she performs the foot screen. Linda is using the diabetes foot screen form included in the Saskatchewan Clinical Practice Guidelines.
Okay, Kim, so the first thing that I want to do is check for swelling. So I'm just going to go right down the legs and check right at the ankles to see if there's any kind of swelling there. We're just going to check to see about the shape of your feet now and see if there's any swelling.
Okay.
Okay. So the first thing I'm going to do is pick up the foot here and have a look. I'm looking to see and feel if there's any kind of lesions or any kind of bumps, or if there's any bruising or any kind of dried skin. Checking along the back of your heel to see if there's any callus. Feels good. And now I'm going to just check with your toes to make sure that there's no dry areas underneath there or any cuts. Does this hurt at all? Is there any kind of...
No.
No? Okay. So that's good. Now let's just check the other foot. Okay. Again, I'm just going to check along the inside of your arch, and this is something that you might want to do at home. Okay, just to make sure that there is nothing that's sore or dry along there. Okay. The heels are very nice. Just going to check again the bottom of the toes. Now that's a tricky thing. Sometimes you may want to put a mirror on the floor so that you can see if there's anything. Any soreness?
Nope.
Nope. Okay. And that's good. So now we're going to check your temperature. So I'm going to just do this by placing my hands on the top of your feet. And what I'm looking at is to find out if the left and the right are the same temperature. Because what that indicates is that the circulation is good and equal on both sides.
Okay.
And yep, temperature feels great. So now I'm going to test the strength of your feet. I'm going to place my hands on the top of your feet, and I want you to push against my hands. Push up. Excellent, that's very good. Relax. Now I'm going to place my hands underneath the soles of your feet, and I want you to push down. As if you're pushing down, making a pointy foot. Good. Excellent. And that's just perfect. Your feet are just fine.
People with diabetes want to avoid foot infections which may occur if the skin becomes broken. Ask the client who cuts his or her nails and if there are any problems. If needed, a referral can be made for assistance with nail care. When examining the foot, note an abnormal foot shape, swelling, increased foot temperature or redness, and weakness. In Saskatchewan, we recommend testing 12 sites for sensation on each foot using the monofilament. It is important to look at the footwear for fit and pattern of wear. Shoes should fit well with good support and have lots of room for the toes. Look in the shoe for any foreign objects, such as a stone. People with loss of sensation are often unaware that they may be stepping or walking on a sharp object. They often experience decreased sensation to heat and cold.